smoking. This is much more important. And how much your dentists know, and how much your doctors know. So here we are again. The thing we really need is no more experiments. We have 20 years follow-up on our fibromyalgia patients. 4 million of patients, mostly in America, do suffer from fibromyalgia, which is currently a curable disease. Looking on the numbers before I went, I found out that one fibromyalgia patient per annum will cost $16,000. Making 16,000 times 4 million, you get $60 billion per annum, only on fibromyalgia. And I can show you data that we can cut it and save halfway or more. Okay? So that's when we are in the business, because we can show, who cares about patients, but we can show that you can perhaps rescue the economy of US by it. Okay? So, this is what we are fed with, and I would be cautious for chronic exposure to silver, definitely. Acutely, if you have an infection, you can definitely take it and it will kill your body. But I wouldn't do it on the chronic level, because in animal studies it is shown that mercury, gold, but also silver can in susceptible rodents, and I'm sure animals, cause autoimmune disease. If it would be aluminium, it would be a little bit better. It is a neurotoxin, sure, it's very advanced, but transition metals are really serious, and I wouldn't like to be fed by silver longer time. No, I wouldn't. Nickel, I told you, is another which is really, really bad. It's our food. And mercury, we have talked about molybdenum. Gold, it's also as a color, and gold is not innocent. It's not a shining inner thing. It's again transition metal. Now here we go again. Our dear FDA. What they actually were forced to do, they didn't like it, but they did it anyway. In June 2008, they had reclassified amalgam from safe for everybody to safe for many, but not for all. And who are the people which are at risk for mercury-induced side effects? Yeah, there are people who have abnormal response to mercury. That means people with mercury allergy or mercury-induced autoimmunity. And FDA said, or it used to say, and they retracted it very quickly from the website, it disappeared, I'm sorry to say. If you believe, if you have allergy or sensitivity to mercury, or any other metals in the amalgam, you should discuss treatment option with your dentist. So if Huggins listened to what FDA said, and if they said, I'd like to normalize that, he could actually prove that he can do what he does. He is a clinician, he's not an immunologist, but there is a window of opportunities which we all have, because we are working according to FDA. And don't forget again, if we want to win, and we want, we have to play according to rules. Otherwise, there is no chance. So, it's coming up now. Mainstream medicine is waking. And this is Mark Houston's review paper, and when I see that, I say, hey, something is coming up, and it's again in America, things are going. This is Vanderbilt University, and what the guy says is that he presents information from a 100 peer-reviewed journal showing that, and actually gives advice at the end of the paper. If you have a patient with cardiovascular disease, you should always ask about exposure to mercury. Isn't that fantastic? I would like to kiss this guy. Because this really gets us at home, because this was published in one of the major journals of clinical hypertension. So this is fantastic. So something is happening. So this has been years ago at Astra, which nurtured me for 10, 20 years and gave me the possibility to do this. And one we had a PhD student which came to Astra and said, hey, I would like to do something meaningful during 3 months. And I said to a colleague at department, why don't we look over mercury holes? This is easy, autoradiography is always done with any drug. You run your label to the new drug and then see where it comes. So we did the same with E131 mercury and injected this mouse into the tail, and 6 hours or 10 hours later we froze the whole mouse, they get snips, and then we put ultra-sensitive photographic emulsion on the liver, and everywhere where white things are, mercury has been bound. So it's bound everywhere, as you see, but in some places it's bound more. And these are places where collagen structures are, because collagen is full of SH groups. This is very mercury bound. So the dentists have pain in the back. It's not because they do like this, it's because they are exposed to mercury. And you don't see much in the brain, but you see the trachea here, you see liver, of course, you see bladder, and so on. So if somebody will tell you, well, you know, this mercury is just very little, it doesn't play a role, well, you just show me this picture. I can send it to you, or this is cortisly, and this is our foundation which has it. And scoliosis and other things have direct connection, both in animals and in children, with exposure to mercury and other metals. This is another thing which I would love that we will look more, and this is connection between breast cancer and metals. And the reason why it's really about my heart is that more and more women in the younger ages have been affected by the disease, and they are treated extremely badly. You remember the story, and so on, according to our opinion, completely unnecessary. I think Mercola had the same things, and Gary here too, because one thing is susceptibility, and if you look into Joey's mouth, she has a beautiful white trunk, she didn't have any implants. Nevertheless, the report has been published 2006 together with people with University of Prague, my older university, and we looked on the content of heavy and transition metals in breast cancer biopsies, which are the blue ones, and the corresponding calcification which we got from reduction surgery. And as you can see, they are extremely high concentrations, not only of iron, but also other metals, and 6 times more mercury, cadmium, zinc, of course, is always there, but nickel, chromium. So when we published that, people wrote to me and say, so what? You have more inflammation in the breast, you have more circulation, so, you know, these metals are bringing down, so this might be secondary. So we come back again to egg and to chicken, even though we know that nickel is or mercury cause the cancer. The only way how to do this would be, of course, to remove the content. Everybody of these women had, of course, amalgam. Everybody has it in our country, in Czech Republic. So since there was no one who was interested to do this in Sweden, I really tried. I didn't know what to do, but then I went to New Zealand, of all places, and met my old friend Mike Godfrey, which you might know. And Mike and I know, again, many, many years, he's another trooper, which should get a reward sometimes, definitely. And when he came there to the city of, or to the Bay of Plenty, with my daughter, medical Dr. Jenny, he sees me and says, Vera, I know what caused breast cancer. And at that time, we already published our paper, but we didn't know about it. And he said, yes, I said, sure, what is it? Oh, it's the root canal, he said. The reason behind was that he did a thermography, that's why I'm so interested, on 3,000 of New Zealand women. And to the thing goes that it's a beautiful place, New Zealand, but it's contributed extremely very much for 2 sides. One is the earth, very little selenium, and the second thing is that the most proliferating and successful profession are dentists. So that means that 96% of all women in New Zealand have mercury. So what Mike saw is that thermography, which was positive, and then on the basis of thermography he did a biopsy and we found primary ductal carcinoma. He found that these women all had a very heavily restorative mouth, the root fillings and so on. So that's why he said to connection, heavy metal. I say, well, sure, it fits with us. We found it there. So just to tell quickly story, he had to run off because he was to Wellington and lecture, and he stayed there in his office, and Jenny started to look for some hotel, and there on his reception list was the answer to my question. Believe it or not, in New Zealand. There was a small booklet which was advice to women which were suffering from breast cancer. And there were results of thermography on one lady, which was typical redness. And then 3 months later, after change of the lifestyle, meaning removal of dental metal and chelation, PhD, ACIM, the thermography turned negative and stayed there. And he went back to the doctor at the hospital and he couldn't find any more cancer. So seeing that, I said, my God, now we got it. And I get back to Sweden and I called my directors of the hospital where these three ladies were dying and said, well, this is not really aggressive, this is complementary, could we look at that? They were not interested. I went to the international meeting, breast, in Torino, in Italy, in the hope that somebody will be interested. Believe me, this is true. And I got accepted poster without data. I was standing there as an idiot because all these young people were running and eating from these producers of beta-ferron and all these immunosuppressants. No one was interested. No. So what we simply need to do, we have to do it ourselves and everything like that, and then it will be accepted. So this is the story about breast cancer. So you have to differentiate between toxic effects, which are definitely there, with all the disruption of membrane, of all relative oxygen species, but you have to realize that toxic effects, even if they would trigger inflammation, local, this inflammation is very short term. The cytokines don't live too long, while what's happening if you disseminate metals all over the body, for example into the heart, it will change the structure and it will trigger inflammation. So this is what I have already told you, that in animals, both in rats and in mice, but also in bigger dogs, depending on the genotype, if you give very low concentrations of mercury or nickel or gold or silver, you will either stay healthy, you have only skin allergy, you get mixed, or you succumb to different autoimmune diseases. Animals are better off than these because they do produce C vitamins and methylphenidate. So after this, they usually become resilient to other revoking, while we don't. We need to have C vitamins, unfortunately, to do this. So that's why we need to eat supplements. So how do we diagnose? And I already mentioned that in some cases, like for children, I advocate recurrent analysis. Blood mineral analysis will not tell you much because the half-life of mercury is 3-4 days, so that means it will become immediately bound. So unless you have a major accident and you are polluted by mercury, which might happen if you work in the factory with chlorine industry, doing the alarm, fluorescent lamp, you can do that. This one, I would be very cautious to use, and especially in children. Because the things which I already told you, if you happen to be allergic, you will get worsening of your symptoms. And this is not what you want to do. So I am much more for to find out how it is going. And then, depending if you are or not allergic, then you have to do your custom-made detoxification. And there are many ways how you can do that. allergy or delayed type hypersensitivity, which is virtually unknown in mainstream research literature. And just 1 week previously, I have been speaker in Edinburgh on the meeting on autism. And to my surprise, 2 major mainstream researchers in autistic disorder were invited and speak. One of them was Mary Horning, which has reproduced autistic symptoms in susceptible mice, of certain mice which were developing, by giving them a little bit, tiny bit of thimerosal, which is this adenosine vaccine. And the second one was research from Martha Herbert, which was from Harvard Medical School. They are excellent people, they deliver very nice lectures, but not a single one from them or any other speakers knew what T-cell responses and delayed type hypersensitivity is. Why is that? Because there are different treatments for it. You can find money under it everywhere. And the reason is simply that pharmaceutical company like Pharmacia couldn't patent and deliver a kit for T-cell allergy. So they say allergy is IgE. IgEs are 10% of all pathologic responses in allergy. And this one is definitely the rest of them. T-cells are at the beginning of all abnormal immune reactions. Everyone. So that means some T-cells will go then to B-cells, to antibodies, some will not. For gluten allergy, I think about 10% you can find in the antibody, the rest is on the B-cells. Nobody knows anything about it, and nobody knows that. You just know that if you have gluten allergy, you say it, or incompatibility, or susceptibility, and you will remove the gluten, and your patients, you ask him to refrain, he will improve, but they are no antibodies. They are T-cells, but nobody looks at them. So by this testing, which is actually known only for contact sensitization or contact allergy by dermatologists, you can also, in systemic allergy, it's not only about the skin. And what they do is they take a patch test, so-called patch test, which you know, and they put the implicated substances, like for example nickel, onto the skin, and after 48 hours, so that means it doesn't come immediately, it comes later, that's why it's called delayed hypersensitivity, you see the redness. Lymphocyte transformation, that has been around for many, many years, but again, it has not been validated, there was no pharmaceutical company to suppress that, so it's there and slowly, it's accepted. Yeah, but it's nothing which actually people in autoimmunity research know at all. So what you do is that you draw the blood, you can do it, you can ship the blood to laboratories. There are now 2 laboratories in America, about 11 worldwide, which do this test. We have just signed a contract with Canada, with CML labs in Canada, which are huge. So they will do a lot of information and education. And what these guys do, if they are there, they have receptors on their membrane which will recognize the antigens which they have seen in the past. And if they do that, they will divide and there will be a clone which will be then detected 5 hours later. So from 1 cell in 100,000 cells, you will now have 1 cell in 100, which you will be able to detect by objectivity, by timely incorporation. There is a link to autoimmunity. It's not only type 4 allergy, it's also autoimmunity, which is caused by metals. And this is, again, very well known in animal systems. There are some data, and we have published quite a few things together with my group in Charles University in Prague, showing that in most of autoimmune diseases in man, you do have increased abnormal reaction and metal triggers inflammation. And if you remove this trigger, you will remove many of systems, and in some cases you cure incurable diseases. So this is of course autocell hypothesis, showing you that binding not only of mercury but all other transition metals will change the cells. The microbes and viruses can do the same. This is not only metals, but metals do that definitely too. And in susceptible people, you will trigger inflammation. which is then perpetuated or not, depending if the trigger is there or not. Fatigue is frequent in chronic diseases, and I hope you know that this is not the toxicity. This is result of chronic day after day after day inflammation. And the good thing is that this is reversible. If you find out what is causing inflammation, you can downregulate axis, you can normalize the hormones. Of course, minerals and vitamins will help you, zinc, selenium, and so on, chelation under some cases, and so on and so on. And the good thing again is that you can see how your therapy is successful by blood test, by downregulation. These things have been published years ago. This is from paper on 3,000 patients and 116 controls. So again, as everything new, we have been fighting for 10, 15 years against the wall, and they tried everything to discredit malaria. Everything. And they say there are no controls, there are no studies. Nevertheless, this has been published 1999, showing the major offenders or moisture sensitizing agents being mercury, gold, palladium, and nickel. Quite a few people which thought so-called healthy asymptomatic, they were still allergic to nickel. The reason being that even if you do nickel allergy patch test, it's very insensitive and it will not show all people which are nickel sensitized. So what we did at that time was that we have removed offending metals, sensitizing metals from patients from chronic fatigue, and we have found out normalization of testing or responsiveness, but also improvement of health, long-term improvement of health in nearly 80% of all chronic fatigue patients. And this has been published in 1999, and virtually nobody refers to this paper. It's just sitting there. And nothing really happened since then. So since then we have done follow-up. We have now follow-up 15 years on these people. They are sick. And we have now looked on fibromyalgia, which we have also done 15 years ago. And now we are going to publish this, hopefully. And this is a small cohort, longitudinal, showing 15 patients with fibromyalgia and their response to different metals and 10 controls at the same time. And this study is the same results shown in two other studies, which are one is in press, one is going to written, one is in Italy by Professor Paolo Pigato, which he says that 90% of Italian fibromyalgia patients respond to metal, either in patch test or in ELISA test, and the one is in Paris by Philippe Tournesat on 100 patients with fibromyalgia and ME, showing exactly the same thing. So together with our data, 100 patients, you can say that definitely quite a large group of patients with unspecific symptoms is suffering with chronic inflammation due to dermatitis and other things. This is the follow-up, which we always do. These are the original results. Stimulation index very often 14, that means cells in the presence of gold have been stimulating 14 times more than without gold. And then, after the removal of gold crowns, 97 and 2005, response became negative. Palladium is negative, nickel is going down. This has been published in many other cases by other people as well, and this is our invariant observation that if you calm down cellular inflammation, you will calm down disease as well. This is another fibromyalgia paper. Patients, actually the same thing. Just in this case, this is phenylmercury, cadmium, and nickel is rather low. So it's individual. And this is number 3. This is interesting English patient. Her whole life she has been incapacitated by systemic responses to metals. She first got amalgam filling, she developed urticaria, then she underwent tubal ligation with nickel-containing Crohn's, she developed irritable bowel syndrome. And after additional Crohn's and bridge work, she got a diagnosis of fibromyalgia. So when she was 53 years old, after whole life suffering, she showed extremely strong reaction to nickel, but nothing to other things. And it just turned out that her crowns were made of 75% of nickel. So the treatment was removal of all nickel-containing crowns and tubular clips, replaced with composite and zirconium, and then she improved and she is now healthy. And this questionnaire, which is very useful, it can be on our website. It shows you that after the dental treatment, usually people see worsening of their symptoms, which is actually provocation test, which you have done. So we find it very useful, and we would be very happy when they use that. They say that it was very similar, like the things which worsen after oral chelation therapy with PFPS. So again, be careful. And this is Per Mason. He is a medical doctor from England, which developed rheumatoid arthritis at the age of 46. And this happened after he had operation with a chest wire placed after both operations. And he developed acute rheumatitis, bleeding auras, and has been diagnosed rheumatoid arthritis. Then something happened which sort of put him wondering. He went to Paris and he forgot his reading glasses. So he bought the glasses, cheap glasses with nickel-containing frames, and he seen that he has eczema here. So he was wondering, oh, what about if I'm nickel allergic, and maybe what about these chest wires which contain nickel? Could there be any connection? So he contacted us for ELISA testing, and this is the response: strong sensitization to all three components of nickel chest wires. So after that, he went over to colleague surgeon who did the surgery and said, well, you have to get away these chest wires because I'm allergic to these things. And the surgeon said, well, you are crazy. There can't be any connection between your eye and sensitization and chest wires. This is absolutely crazy. But he was his colleague, so okay, so he complied. And after 3 months, he started to feel better, but he still didn't really trust. He still was a lot of mainstream, so he was going on with methotrexate. After 1.5 years later, he stopped methotrexate, and now he is healthy. So this is acute rheumatoid arthritis, and now the surgeon said nickel allergic. So I think my time is a little bit passing, so I will mention another drastic case of people which we actually help regain health. And this one comes from Australia. And the life test has been done in Australia. So this goes about multiple sclerosis, and I have already said it's immunological disease of autoimmune unknown origin. But we do know that metals play a role, and that oligolymphocytes are macrophages which are taking up macrophages, metals and other things. This is from our study, which is being written. We have the numbers, 106 patients with MS and controls, and we see highly significant responses again to our very famous frequent sensitizers, mercury, metal mercury, gold, lead, palladium, titanium, nickel. So hopefully we will get this. And now this is the case. She was a young female, she was non-smoker, because smoking, of course, exposed to nickel, but she didn't do that. But many of these patients get their alternative braces when they are 15 years old, and this is where they start to be sensitized to nickel. Many of them develop epilepsy afterwards. Nobody gets contact. Anyway, she got one cobalt chrome nickel crown. That was all she got.